Hi, I'm Georgia Raisman. I'm here today on Front Up with Holly McGowan, who's the president of the Alliance for Substance Abuse Prevention here on Nantucket. Holly, how much of an issue is substance abuse on Nantucket?
Oh, I feel it's a big issue. It's quite a big issue. We have, a lot of problems with substance. We have so many events fueled with alcohol, primarily in the full season, but it's a problem year-round. I believe we actually have more alcohol outlets per capita than most other small towns nationwide. So, we do have an issue here.
And is it, your organization, the Alliance for Substance Abuse Prevention, is that a private organization? Is it a governmental?
It's a nonprofit.
It's
a nonprofit, and we've been enjoying a grant from the federal government for the past 9 years. We're in our final year of having the grant, and the grant allows us to present programs and strategies for the community to prevent substance misuse.
So are those programs geared at children or young people to keep them from becoming abusers?
Protecting the youth is our primary concern, yes. But we also, in order to protect the youth, you also have to educate the adults. And so we kind of tag team and do a little of both.
So you said that alcohol fuels a lot of our activities in the summer, but alcohol is not in and of itself a problem. It's the person. It's how it reacts with individual people. How some people become addicted to it and become alcoholics, and others do not. So, which is a medical issue, is it not? Do you think that other kinds of opioid issues are medically based as well? And how do you try to deal with those?
Well, any addiction is a brain disorder. It's a medical issue. So yes, there are certain individuals who are more susceptible to developing addiction, and that has to do with your gene pool, if it's in the family history, your environment, if the prevalence of substances in the environment, and beginning at an early age. So that's why we have laws that regulate using substances when you're 21 and older, because as the brain is developing, that's a really vulnerable time for your brain not to make the connection it needs to from the back to the front, the prefrontal cortex. And when you disrupt that, you can really create a pattern of addiction for yourself when you're young and starting a substance.
It's a stronger connection if it's made earlier in your life than
well, you risk not making the connection. That's when your brain is developing. So then you would have to relearn later as an adult, new habits and new ways of living your life so that you can think properly again. So your brain resets.
So when you consider substances, alcohol is one of them, and I guess opioids or medical opioids that are. I mean, alcohol is perhaps the biggest one, but what do you see as the other substances in the community that are widely misused?
Well, we have all the drugs here. Unfortunately, there's cocaine is really a problem now. Heroin, there's fentanyl in heroin and cocaine, which makes it that much more dangerous, easy to overdose. It's a very powerful drug, fentanyl, and we have issues with prescribed medications also floating around. So that's why one of the missions of our agency is to offer drug take-back events. So we offer them 3 times per year.
Oh, I've seen those. I've seen ads for those. And what do people do during the drug take-back events? Unused opioids, is that the idea?
Unused any medication. So it's an opportunity for anyone in the community to drop off if they have a medication they haven't finished, whether it be a controlled substance or non-controlled. They can bring it in that day. Our next one is actually scheduled for our Prevention Campaign Week, which is going to be at the Island Pharmacy on the Saturday of Red Ribbon Week. So that runs between October 22nd to the 30th.
So tell me about Red Ribbon Week, because that's something else that prompted our thinking about having you come to talk with us.
Yes, that is a national campaign. Can I hold that up?
Yeah.
This year's Red Ribbon Week theme is Life is a Journey.
Travel
Travel
drug-free.
drug-free, exactly.
That's a good motto.
So this is what we promote in the schools during that week and in the community. The Board of Selectmen read a proclamation declaring it Prevention Week. The middle school has a contest, whether it be a media contest or poster contest, to create prevention messaging. They also sign a pledge board to be drug and bully free, as does the elementary and intermediary schools. And we have a student on our board, and she will make sure the message goes out to the high school students. There's a Wear Red Day school-wide in the school system.
Is this the first year that it's been done, or has it been done before?
Yeah, we've been doing this campaign for years, and I think as we've been doing it, it's becoming more known in the community. We've been getting a lot of support from the town for this campaign.
Has it been well received?
And they help us run it. It's very well received, yeah. I'm really happy that it's progressed to the point where it's a pretty known thing. It's actually on the school calendar now.
Oh, good. Well, that is good. That's a
Yes.
level of acceptance that's really good.
Yes.
So
it's wonderful.
are you getting it to be cool yet, or is it not yet cool to be considered drug-free?
I don't know. I mean, I think that that's always a message that's important
You have
to
to reach
create
the
among
right
the
people.
students. Yeah.
Do you think, last night we voted to limit the number of marijuana dispensaries, recreational marijuana dispensaries on the island to a percentage of the working liquor stores, year-round liquor stores, 20% of the year-round liquor stores, which puts them right now at 2. How did you feel about that?
I was happy that we stuck to a limit, and we'll see going forward if that changes. But I was pleased with that outcome. I thought that was wise to proceed with caution with this issue.
What do you feel about recreational marijuana?
It's a choice, and if you're old enough to use that substance, then that's your preference and choice. So.
Is there any?
That's my
people
personal
are still
opinion.
saying, or some people are still saying, it's a gateway drug. Is that an old-fashioned idea, or is it in
No.
fact a gateway drug?
No, it actually is an addictive substance. That's been proven, scientifically proven.
So it is an addictive substance, but not necessarily a gateway to other.
It can be a gateway drug. So statistically, over 16% of teens who smoke marijuana will become addicted to marijuana and are also more susceptible to becoming addicted to other drugs, including alcohol or opioids.
Is that 16 or 60?
Over 16%.
16%.
Yes.
So that's like one in
Yes.
6 people.
Yes.
That's
so,
interesting.
So my interest is protecting our youth.
Yeah.
And one of the top 5 risk factors, when ASAP did a risk factor for youth in the community to substance misuse and abuse, one of the top 5 was availability in our community. So I think it is wise. We already do have a problem with the alcohol, as I said. So it is wise to proceed with caution with the rolling out of the marijuana recreationally, I believe.
So it's really, it's hard to be enthusiastic about introducing yet another, but I guess it's simply the way things are happening these days, that more addictive substances are available. I think I was reading and listening somewhere to a medical show that said sugar is an addictive substance.
Sure. Oh yes, you can
So-
have many. There are many forms of addiction. Gambling is a form of addiction. So yeah.
We don't legislate them all out of existence.
And some are more harmful than others. And certainly opioids are extremely harmful. We have a huge rate of deaths in this nation because of opioid overdose.
The thing on my mind would be if I were a parent and I were listening to this, wonderful outreach effect that you were having, I was thinking the other element of an outreach is, what's my child doing when he's not actually in school being watched over? I mean, how do I know who my kids are hanging out with? How do I know who the kids are in school that my children should not be hanging out with? And how does a parent know when to pull a kid out of a situation that can be, because he's just with the wrong kids? I mean, is there something that you can do to increase parental awareness of watching for signs that your kid is not with the right people?
Yeah, you do have to be really vigilant, I think. And I believe in a parent talking to their child even is at a younger age. 10 is not too early to start talking about this issue. Maybe even earlier. You start slowly and progress with the subject matter.
What do you talk about when they're aged 8 or 10? What do you ask?
You provide education. You let them know that there are substances out there. Vaping is a really enormous issue right now.
Well, that's interesting, because even vaping is dangerous. They've been showing.
Vaping is very dangerous. It's actually very addictive. They're vaping things. They can be vaping THC. They can be vaping nicotine, which is, we all know, highly addictive. It looks cool. It looks harmless.
Right.
It comes in flavors like bubblegum and fruit. The smell is very sweet. So even if they're not vaping THC or nicotine, we don't actually know what chemicals are in some of these vapes.
So it's showing them what.
And there isn't a lot of regulation around it. You can buy it over the internet. You can buy it in a store.
Right, so you're
it's marketed towards children.
What you're telling your children is things that look attractive have to be considered carefully, but also the people who use those things, who might look like they're cool kids, are potentially going to get you into a great deal of trouble.
Yeah. So it's really important to continue the conversation, have it frequently. Study yourself about the vaping and marijuana and alcohol. Know how it's going to affect your child. As they get older, you need to, or you don't need to, but you should be talking with them very candidly. I think covering up, or one parent being in the know and the other parent being left out is a big mistake. You need to always be working together to talk to your child. And statistically, talking to your child about these things does help. The children who know that their parents are concerned and involved in their lives are less likely to go in the direction of drugs.
You're at the end of a 9-year grant, and what are you going to be doing to renew your grant or further your mission?
Well, we're hoping to become sustainable after the end of our 10 years. So we'll see how we're able to do that.
Who are active with you on it? Do you have a board? I take it as.
Yes. So our treasurer is Alan Bell, and we have a secretary, Heather Francis, Vice President Elizabeth Hitchcock, and other very active board members. Brian Friscotti is on our board. He's with a Safe Place, and he also happens to be the mobile crisis interventionist for the island. So we have some very good and interested board members in this cause. So I'm hoping we can keep it all going.
Yeah, well, it's fundraising too. It's not just
fundraising. Yes,
yeah,
that's something that we tried a little bit of. We've just dipped into, but we need to more aggressively pursue fundraising.
I would think so. Do you find that suicide has always has been an issue on the island? Do you think that opioid or other, not opioid necessarily, but addiction issues play into suicide? Do people become suicidal because of their addiction issues or their inability to deal with them?
It's really beyond my I'm not an expert to speak to that issue, but it is proven that substance and mental health issues are often hand in hand.
Do you work with other mental health providers then on island?
We collaborate with the other agencies to have events. The hospital, we had our last drug take back was with the Nantucket Cottage Hospital. I think going forward, once they have their new building set up, that they will play a more active role in drug take-backs as well. And we've collaborated with the Fairwinds, with the Gosnold on Nantucket to have informational events for community and parents. So we've enjoyed a really good working relationship.
No, it's a huge topic, and what with drug overdoses and the use of this Narcan that kind of brings people back. Do you do anything by way of helping people find rehabilitating facilities or some ways of finding their way out of these addictions?
That's for the other organizations
end.
who work on the treatment.
You're on prevention.
We're on prevention. Yes. Yeah.
How do you prevent them? Mostly educating.
It's education. It's also their strategies that you can develop in a community. There are evidence-based programs that schools can adopt. We do have some programming in schools that the schools have implemented and used here and there. Yeah, it's not a consistent program overall, but they do substance prevention in
Are
the
they movies
PE
or
health classes.
videos and things like that? I
They're-
remember scary videos from when I was,
Yeah.
a little kid, but they probably don't have such scary videos anymore.
There are some educational videos. We've actually been able to purchase some with the help of the Community Foundation for Nantucket grant, and they're short videos on the different substances, and they're called true life stories. So you'll have someone speaking, a teen speaking about their personal issue and how it impacted their life, and how they were able to get help. And those are with the PE health teachers at the schools now.
Have you ever done that with real people from the community?
We actually did a radio program last year with one of the people that ASAP works with is a substance use disorders expert, Janina Keene, and she visits and does a family awareness workshop on addiction periodically for the community free of charge. And 1 year we've recorded a year's worth of radio spots with AC Radio.
ACRS,
Yeah, it's the not the 97.7, but they have an NPR
Right.
version. And people did come in from the community, and they shared their stories either anonymously
I
or
would think that might
not.
be a wonderful video series too, or even an in-person meeting at the schools.
Well, the schools do have people in recovery from the community who come in and educate with
okay.
the,
It's
with
not
the
through your
students.
Aegis, but they do that.
Right, they do that. But our the shows that we recorded with the radio station are now on our ASAP website, so they can be accessed there, and they're very interesting and very useful.
It sounds like it's a difficult field to get hold of when you're working on prevention. So I think kind of giving people examples of what hasn't worked, has and has not worked in the past, and giving people examples of people who've pulled through and recovered, because often it seems like a thankless situation where people get into the grips of one sort of opioid or one sort of narcotic or another, and then really can't find their way out. It can be tragic for them and their families. Do you help families as well in the prevention effort? Do you try to educate families about?
Sure, we do by having presenters come and the family awareness program. Last year,
Family awareness.
It's Family Awareness Program on Addiction is the name of the program, and it's a 2-day program. So
Wow.
it's geared towards any person whose life has been impacted by addiction in any way. So you could be
That sounds very useful.
suffering from addiction yourself, in recovery, a family member who has a loved one who has substance use disorder. It's really a very powerful program, and has been very well received by people who have attended.
That sounds like an extremely useful program in addition to the ones geared at at children.
Yeah, I hope people will take advantage of it. We do send out a lot of information, flyers, and advertising when Janine is here. So, and also there are lots of programs being offered through Fairwind's agency now, and Gosnold on Nantucket. They have a family support group. So both those agencies have a wealth of resources for people.
It certainly is good work that you're doing, and I wish you lots of luck in continuing to do it, and thank you for coming in and sharing all this for me. It's great to have
Thank
met
you.
you, Holly.
Nice to
Appreciate
meet
it.
you too.